All right. Hello and welcome to Psychedelic Chat, the monthly interview series for the Organization of Psychedelic and Entheogenic Nurses. Oh, hold on. Technical. All right, 1 second. Technical difficulty here. I'm hearing an echo. Wendy. Technical difficulty here. And I am a founder of OPENurses. So today I will be interviewing another founder. Technical difficulty here. And I am a founder of OPENurses. So today I will be interviewing another founder. Oh, sorry. Okay, echo is candled. So my name is Wendy. I am a founder of OPENurses. Today we'll be interviewing Liz Willis. She is a co-founder of OPENurses. She has practiced as an emergency registered nurse in critical care settings for over a decade. Her nursing path began at Sonoma State University in Sonoma County, California, and has since taken her to many amazing places locally, as well as nationally and internationally. Psychedelics, peer support, harm reduction, and nursing are areas where she has received advanced training and has cultivated deep experiences. Prior to and during nursing school, she volunteered and worked for organizations as diverse as the Humane Society of Sonoma County, Planned Parenthood, the Red Cross, and Sutter VNA Hospice. After completing her residency at Harrison Medical Center in Washington State, she returned to the Bay Area by way of Highland Hospital in Oakland in 2015 to the University of California, San Francisco, where she currently works as a frontline provider, is a member of the ED Disaster Committee and the Green Team. Liz is also proud to be working as a teaching assistant in the innovative Integrative Psychiatry Institute's Psychedelic-Assisted Therapy Training Program. Passionate about humanitarian work and disaster response, Liz has volunteered as a nurse for the Red Cross in Tennessee for tornado relief, TIMI in Ecuador, and has served with other like-minded souls in Bolivia, Zimbabwe, Cambodia, and Laos. Since 2013, as a volunteer with the Multidisciplinary Association for Psychedelic Studies Zendo Project, Liz has participated in all roles, including medical lead supervisor, training others in psychedelic harm reduction, and holding space safely at numerous events and festivals in the United States, Costa Rica, and South Africa. She is a 2017 graduate of the second cohort of the California Institute of Integral Studies Certificate in Psychedelic Therapies and Research, and she earned her Master of Science in 2020 from UCSF Psychiatric Mental Health Nurse Practitioner Program. Her capstone residency was in community mental health at Santa Rosa Community Health Centers in Sonoma County, following clinical immersions in psychiatric emergency services, urgent care, and primary care in urban health centers for underserved populations in San Francisco. Liz facilitated a women's health group at the MSC South Shelter Program. In 2021, she was honored to serve as a supervisor for the launch of the pioneering psychedelic peer support line, Fireside Project. Her personal healing journey began in Peru, working with Shipibo traditions, and ultimately led her to Tenochtitlan, where her path as a moon dancer and a pipe carrier walking the Nahuatl lineage was initiated. Liz is looking forward to her future role as a PMHNP, while she will continue to fulfill her mission to honorably bring plant medicines and plant entheogens to Western medical model by elevating the art, science, and spirituality of nursing in the fields of psychedelic-assisted therapies and research. It is my pleasure to welcome Liz Willis. Hi, Liz. Oh, I think you're on mute.
Hi, Wendy. Thank you so much for having me today.
Yeah.
It's my pleasure and honor to be here. Andrew, thank you for doing our tech, and everyone listening in today or in the future, thanks for hearing what I have to say and to share with you.
All right, and feel free to pop in the chat, people who are listening live, where you're listening from. And if you have any questions, we will take them at the end. Okay, so we had your extensive introduction here, but tell us a little bit more about the trajectory of your nursing career and how you got involved with psychedelics as a
Okay,
nurse.
I would love to do that. So I was thinking about how my nursing career and psychedelics came together. And this happened, I became a new graduate nurse and moved to Washington State. At the time, there were no new grad ER jobs in California. And my brother still lived in the Bay Area, and he invited me to come to Oakland. And he lured me in with an invitation of being able to earn continuing education credits to hear a nurse talk about psychedelics. And it was pretty enticing. So I flew to Oakland and we stayed at the Marriott. This was a couple MAPS conferences ago, and my very first one. And for those of you who aren't familiar with MAPS, that's an organization that has really helped pioneer the field of psychedelic-assisted therapies and research, and getting it advanced to where it is today in phase 3 and about to be legalized to be used as a treatment modality. And so it was an amazing experience. And here I sat in the audience, just enraptured, listening to Annie Midhofer as she spoke about her work using MDMA-assisted therapies to help with PTSD in the population of veterans. And in the audience, that's when I just realized I was going to be a psychedelic nurse researcher and therapist. And that was going to be my dream and my mission. And I've been on that path ever since. So fortuitously, too, at this conference, I met some people talking about a project called the Zendo Project. And they were saying that they were going to be at Burning Man. And I love Burning Man, and I'd been many times before. And they also asked, for people with medical experience to help be a medical triage volunteer. And that suited me. I love volunteering. I love being a part of the community, and I love the playa. And so my first event was at Burning Man that year at Fractal, where I met some of the people that I hold most dear to my heart, who taught me how to hold space in a festival setting. And I met people just doing this incredible work that I had never seen done before. Being an ER nurse, I was familiar with crisis psychiatric care, really intense suicidality or overdoses, or people in various states of distress, a lot of medicalization, restraints, really kind of sometimes often a darker side of the way we treat people who come into the emergency room, because those are the resources and the time that we have and the tools that have always been known. So I got to have the exact opposite experience. And I've been volunteering with the Zendo ever since that event. And it's changed my life. And I've learned about psychedelic peer support and harm reduction. The third important thing about the intersection of psychedelic medicines for me at that same conference was that my brother learned about the Temple of the Way of Light. And so he journeyed to Peru and came back without telling me anything about it, paid a deposit for me to go, and encouraged me to go. And so I went. And this is where I was able to do some profound healing from the work that at that time I was working at Highland Hospital in Oakland, California. And I didn't realize how hard it was on me. I didn't realize what I was taking home, or even that I had a problem taking on this trauma or coping with it. And it all became much clearer as a gift of the medicine, and I was able to do some deep healing work there. And it's been a part of my path since, in these ceremonial settings and my spiritual journey. And so just want to acknowledge that's where the intersection of psychedelics and nursing began to occur for me. And I've been on that since.
Excellent. Thanks for sharing. So along the lines with nurses, do you think they bring a different perspective to psychedelic therapy work?
Absolutely. I'll use myself as an example first. And I've been an ER nurse for 10 years. So that means that I hold space for people in crisis, the patients, their families, also for the medics, the first responders, the people that come in that we receive patients from. And this is a kind of place where it's always unknown. Everything is really chaotic all of the time. You're in fight or flight working, yet you have to maintain this professional space and really be there, observant and present, no matter what is happening around you. You also have to be able to communicate effectively with the patients, the loved ones, the families, your ancillary staff, and with your colleagues, the doctors, in all of the consults, and again, the professionals that bring them into our care or who you discharge them to. So this is really akin to holding space on so many levels at once, simultaneously, and doing it gracefully and safely. So I think as an ER nurse personally, we're groomed to be always holding a safe space for multiple people in multiple situations at all times. And we're watching those monitors, we're watching the patients. We're ready for any slight change or nuance in the vital signs or in the patient's presentation. In addition to that, in the hospital I work in, UCSF, and every hospital I've worked in, there's not a shift that goes by where we're not delivering the news of potentially a terminal diagnosis or someone is actively dying. We cannot, despite our best efforts, save them, or some people choose not to have interventions. So there's also a lot of layers of communicating really hard information for people to process. So they're having these shifts in awareness and consciousness all of the time. And that being said, we're there for the births, the deaths, maybe miscarriages or loss, trauma, abuse, addiction. We're seeing, in particular in the ER, the microcosm, I think, for all the broken systems in our society and all these cycles that are endless and all the trauma. So I think that nurses overall, in particular, can bring to psychedelic-assisted therapies really this ability to have a quick rapport and a constant, strong, reliable presence and a deep knowledge base about medications and interventions and side effects and interactions, and also a way to just be with someone when they're at their very worst and to accept them and to be with them when they're the most scared, the most fearful, and really with that deep unknown and considering all the losses personally or physically they may have or their loved ones. So those are some of the ways I think nurses can bring things to psychedelic-assisted therapy. And one of the very most important ways is by being able to educate and to advocate. We can advocate for our patients in any situation, and we're fearless in protecting our patients.
Well said. And yeah, I work with oncology patients, not quite as urgent settings, but it's still the same kind of skill sets needed. And I love how nurses are able to translate and educate, right, and fiercely advocate. So along those lines, how do you practice self-care while either in the emergency department or at festivals or when you're holding space in psychedelic contexts?
Well, this has been a long, hard, ever-evolving lesson for me, and it's constantly changing. When I was in nursing school, they taught us nothing about self-care. There was no mention of mindfulness, meditation, and there was no discussion of who are you going to talk to when you get home from a night shift at sunrise, and if you don't have a peer support network, and people don't want to hear the stories that you bring home. They're often too heavy, too brutal. People can't handle hearing about your job. So I think that I had to learn, as many of us do the hard way, how to take care of myself at work, advocating for myself, walking away from a situation and taking a deep breath, or going into a room with this kind of imaginary energetic armor. And really there's so many rules in the hospital setting, right? And there's so many things we can't do, like some essential oils or wearing certain things. So you have to be creative in the ways that you do self-care at work. And it also took me years to learn to even drink water myself, or to go take a break to use the bathroom myself. So little things like getting water and peeing every time I get a patient of water, get myself some water. So these are things that are really challenging to learn in a fast-paced, high acuity environment, but they're essential. And what I have since learned is that I have to take time for myself in nature with my loved ones, family, friends, animals. I have to return to a setting outside of the one that I work in for my own self-care. And when I'm bringing it into a bigger festival setting, this is where I'm thinking about my crew, thinking about making sure we're all checking in on one another, having breaks, and that we all are well nourished and we're rested if possible, or we can take a break to rest if needed. My self-care is making sure that the people around me are also ready and well trained, and knowing that I have a reliable team with me. And when I'm thinking about cleansing the energy after a shift that I take on, it's often so hard to do because we never can really do it while we're working. We're just taking it all on in every aspect. And you can hold it internally and somatically, physically in your body. Injuries can develop. And these things really need to decompress. I like to do a ritual, take everything off and take a shower, bath, hot water, Epsom salts, whatever I can, music, meditation channels, or sometimes I have to, go to my favorite next Netflix show, whatever it may be, to help soothe my soul, or music. And I have to keep these important rituals in my life, seeing my friends, going to see music when we can, and really learning how to share my stories with people and not keep them bottled up inside. I think that's quite toxic. When I'm thinking about ways I care for myself, I also belong to a spiritual community that really is my foundation. And to have that different type of life away from the work, away from the psychedelics, and to have Sweat Lodge, and to have Vision Quest, and to have these things where I can go to the moon dance and be with people who are healers in other ways, healing themselves, doing their shadow work, and just in a different kind of reality than we work in and live in. That's very healing for me as well. When I've been doing some trainings and working with the medicines in the ketamine trainings that I've done, and for IPI, things that are important to me are creating an altar or a space in a session, or inviting the client to do that. I like to have a sacred object. I like to cleanse the space first, the sage, Palo Santo, if I'm able to do that, depending on where you are. So I kind of like to bring in a little ritual and a little ceremony. So those are some of the ways, fresh flowers, things like that.
Excellent. So you mentioned ketamine just now. Mm-hmm. You want to describe a little bit about your ketamine work?
Sure. I'm not personally practicing yet, Wendy. So to give you folks a little background, CIS became educated, earned the Psychedelic-Assisted Therapy certificate, and that included some MAPS MDMA training. And I decided to pursue my master's degree to become a PsychNP. And it took me a long time to decide I wanted to work with ketamine. I've experienced a lot of different realms in my life and give it at work in a different way. And I've seen it used recreationally and abused, and also in the animal hospital setting. So that's a challenge to see with the animals. I personally had a turning point with wanting to work with ketamine, which is right now the only legal psychedelic-assisted therapy we can do, except for some areas where psilocybin is becoming decriminalized, except in the research setting. This switched for me actually last year. I was experiencing my own symptoms of some vicarious trauma from working through the pandemic, and insomnia and anxiety and depression. And this opportunity came to do a group with Phil Wolfson called Integrative, and this was a compassion-focused therapy pilot study for healthcare providers. Mm-hmm. Now, this wasn't used with medicine, but this was the turning point for my desire to want to explore the medicine. And it was because people came to the group that had been a part of his trainings, and some after a session that day, and they were so open. And it was witnessing this openness and the beautiful healing potential of it that I decided to pursue training. So I first started getting trained with Temenos out of Petaluma. Some graduates of CIS started, and then the Sage Institute. And both of those were fantastic. And we had the opportunity, since it was a pandemic, to both use, witness, and be the guide for different people over Zoom and once in person for Sage. So this was transformational for me because I was able to do some deep healing work of my own and to witness that unfold with my fellow students who were professionals. And I'll tell you a brief favorite story of that. I happened to be in Peru when it was my session, and my wonderful co-therapist joined me over Zoom, and I got to do a conscious death ceremony, a saying goodbye ceremony to my dog in Peru in the Sacred Valley, and welcome in all the other animals and ancestors. And this was a really beautiful thing to be able to do, a letting go consciously with this medicine. So since that time, I've been doing some training with ketamine through the Integrative Psychiatry Institute's new Psychedelic-Assisted therapy program, which is wonderful. And that's a completely different experience as well. So I have a newfound appreciation for all of the healing potential and benefits of ketamine, besides as an analgesic or sedative in the ER. And I'm really looking forward to working with it in the future. Yeah.
Excellent. So what advice would you give nurses who are interested in working with psychedelics?
I think advice I would give to nurses interested in working with psychedelics is, again, to do your own work. And this is going to come up, I think, always. I think this is an eternal thing where we have to keep growing and recognizing where we're being triggered and not being reactive in sessions. Nurses are really good at fixing things, but we're going to be watching things unfold. And we've already got, that wherewithal and that ability to be there for a long time and witness the unfolding, no matter what may arise, and be prepared for that. I know we can handle that. But I think we want to fix things and we want to go in. And I think we're going to be sitting back, at least in my experience so far. This is an allowing to unfold where we're not intervening and we're letting the medicine work its way, helping the person to have their inner healer come out. And so this is a place where we're going to need to learn things like transference and countertransference. And we're going to need to have been doing our own trauma work and our own shadow work. And so I would recommend that you find a way to do this that calls to you. And that would be my best advice there. And then I would also say, get involved now and create different opportunities for yourself, and be mindful about who you choose to train with and where. And really be conscious about what you put out there in social media and protecting your license. And there's a lot of new psychedelic training programs and things that seem to be coming up. And I want to encourage people to research who's providing it, who's offering it, where are they coming from. And one of the things I've also recently been experiencing, Wendy, is a new grad PMHNP. It seems that a lot of the jobs out there are really going to be for nurses administering ketamine or doing things really with just a money medical model, right? Maybe IV, lacking a psychotherapy component. So I think it's really kind of immersing yourself in different ways where you can learn what the offerings are, practicing them yourselves in safe and legal context, perhaps establishing plant medicine contacts in other countries or ceremonial things, checking those out, going to where the medicines come from, learning how to honor them and their ancestry. And I think it's an important thing to decide where you would be fulfilled morally and ethically working. Do you want to work with a psychotherapy component? Or are you perfectly happy doing the IV ketamine because some of the research is showing efficacy there for TRD and suicidality? You got to envision, where do you want to work? What kind of setting do you want to work in? Do you want to be in a hospital? Do you want to be in a clinic in primary care? Do you want to have your own retreat center? Do you want to be international? And what kind of population do you want to work with? And think about what kind of training you need. And most importantly, I think that you need to experience the medicines and the therapy yourselves and have your own support network to integrate. You have to learn about integration. And this is something, again, I was never taught about in all my years with these medicines until recently. And so I think integration and incorporating the lessons into your life and into your nursing practice are critically important.
Great. So do you think that nurses need advanced degrees to work with psychedelics?
Do I think that nurses need advanced degrees? I decided that I needed an advanced degree, and I'm glad that I did, but I do not believe that nurses do. And as I mentioned earlier, Annie Midhofer, she's an RN with the BSN. Karen Cooper, I believe she has an advanced degree in another field of wellness. There's so many nurses working already in the field that are RNs, especially at ketamine clinics and in hospice palliative care. I don't think that you need to pursue an advanced degree as far as nursing, but I do think you need to pursue advanced training with either psychedelic-assisted therapies or the methods that I previously spoke of, working with different medicines. Mm-hmm. In addition to that, I think it's beneficial to consider training such as IFS, or like you've done, Wendy, Hakomi, things that you can bring to the table in these long sessions. There's going to be things you need to learn about body work and your presence and healing. One of the reasons I like the idea of an advanced degree is you get more credibility. And I think from working in a research setting, it's important. And I think also even in the hospital setting and from patients. I know, Wendy, when you and I are practicing, we will not only be able to do therapy, but we can prescribe, we can diagnose. We really have a bit of a trifecta, and then we're bringing in our nursing skills and our ability to respond to emergencies. And it's really a great package. And so I think that pursuing an advanced degree in other things like, integrated mental health or really a nutrition background, things like that, where you can really support clients on the flip side of the experience, prepare them, do the experience, but how are you going to maintain a continuity of care and their trajectory down the road? So consider an advanced degree in that regard, I think would be important.
Mm-hmm. Yeah. Great. Yeah. So do you ever worry about backlash from licensing agencies or employers? How do you protect your nursing license? Because we're kind of in this limbo right now. There's, the research studies are out there and there's work happening in other countries. There's ketamine, but yeah, how do you protect your license?
So I do want to say a couple important things about this. My nursing license is one of the most important things in my life to me. I love nursing. It has a world of opportunity. And even though you're just a nurse, you can have endless ways to be a nurse for your entire career. And I don't want to lose it. And I'm not going to lose it for something that's naive and that I could have prevented. So I see a lot of young nurses that post things that they shouldn't, or that talk about things I think that are very a little bit in the wrong setting. And if you want to be taken seriously and protect your license, you need to be cautious about what you share and whom with and when and where you do it. So I would really like to advise that. I think it come from a previous generation where we really kept things more personally to ourselves and to our private communities. And I don't see that happening right now. And I think that it's still dangerous to do that. And to really be mindful about what you talk about and to whom, especially in the public forum. When I'm working with patients and they share with me their experiences with psychedelics and ask me questions, I think that what I am okay with sharing is what I did with you. Yes, I have benefited greatly from these medicines in the right setting and in Peru and in a ceremonial context and in a legal context with the ketamine. And at this time, I don't want to ever do anything to jeopardize my license. And so I hope that one day OPENurses can provide some type of continuing education or presentation to really talk about these issues with licensure, because it is changing. It's changing state to state. Every state is different. Every country is different. And there's a lot that we don't understand yet and that will come up.
So along those lines, can you tell us a story about how others maybe view or react to you when they learn that you're a nurse working with psychedelics? And is there ever a time someone reacted negatively or maybe with shock or something when they found out you work with psychedelics?
I think most of the time people are so excited and they want to share their stories, or they want to tell me about their family member or their parent or their friend who is about to microdose for the first time or have an experience. And they're filled with curiosity and questions. And they want to know the best way to do things, or how they can do it, or if I can guide them on a journey. And people really are seeking these medicines and these therapies, and they're doing it independently often of what is available at this time. And I think that what people meet me with mostly are their own stories. And endlessly I hear about, oh, when I did that when I was 16 or 17 and it changed my life and I want to do it. I need this now, And it very often comes up in the ER setting, especially with our cancer patients. I'm sure it might for you as well, Wendy, even just CBDs and cannabis, but it runs the gamut, especially after, the rise in popularity of these medicines and treatments in the media, because they're working and the medicines are reaching out and people need them. And so I'm thinking, conversely, to try to answer your question about a negative time. And what I keep coming back to is when I first got into nursing school and I had to cut off my waist-long dreadlocks. And I did this volitionally because I wanted to be taken seriously. And I wanted my patients to trust me and my colleagues and the people training me and my educators. And so I'm using that as an example because there are many people who do judge. And there are people who may choose to report you because of the choices to work with these medicines. And negative reactions I've had so far have been few. They've mostly been positive, or people don't know what they are, and then they ask. And so that's an opportunity for me as a nurse to educate and to share the resources that I have available.
Yeah. It has been amazing watching the shift just over the past few years. When we met in 2017 in the psychedelic certificate program at CIIS, and it was still kind of new to be able to talk about psychedelics. That was the first, training program, right, above ground in a university. And just in the years since, it's just been incredible to watch how people know about it now and are really curious.
They do. And I think there's also a lot of misinformation out there. And I know MAPS is doing some great work to prepare for decriminalization and training and educating people. But we really need to be conscious about that. I think that people are going to be using these substances without adequate knowledge or information or training, and there can definitely be adverse outcomes. So as nurses, I think this is a frontier where we can really help educate and train people and answer those questions and prevent harm. Yeah,
absolutely. And that ties into some of the work you've done with Zendo and also with Fireside. So maybe you could explain for people who don't know what those organizations are.
Yeah, I'd love to do that.
Talk about them and how nurses or other people as well could get involved or,
So first, let me talk about Zendo, my long-term love, my family. I love the Zendo. And so I want to just start with the best news. Burning Man is happening this year, and Zendo is going to be asking for volunteers. And so I think ticket registration for sales is beginning today even. But if you're interested, this is my favorite experience I've had. And you could apply to be a volunteer for this year's Burning Man. And what it is it's a safe space. It's a safe container. And when I went to many concerts and events in my youth, there was nothing that existed like this. And one of the main goals of the Zendo project is to provide peer support, a safe space, open all the time during an event, and to have a place where anyone can come and present in any state of mind or situation. This could be substance related or not. It could be any type of psychological distress or anything that comes up. And they can go there without fear of judgment, and they can have someone to be with them to allow the experience to unfold. And some of the themes of the Zendo are the safe space, difficult is not bad, and it's transforming a challenging experience into something that could have some meaning. And so what Zendo does is it really fills this need when people maybe have too much too fast, or they're having a break, or perhaps they've been off their meds because they wanted to go to the event and have a full experience, or any kind of interaction happens where they need assistance in a relationship. They can come here. They'll be paired with a volunteer, which could be you, to be with them for any amount of time needed, and to make sure that they come to a place where they're able to navigate safely back to their camp, their home, the event, whatever it may be. It could be a half an hour, it could be many hours. It's also a place where, if people do need a higher level of care, they are triaged up to that. And depending on the event and the rules there, the outcome is different. And so other ways that I was trying to transform are, like I mentioned before, preparing with this decriminalization effort and training. So really training compassionate communities that are going to be ready to hold space as the future unfolds here. One of their main goals is similar to also Fireside Project, and the Fireside Project is a new psychedelic peer support line. It's pioneering and it's incredible. But it's really dear to my heart. They both decrease hospitalizations, decrease arrest, decrease restraints, decrease people receiving medications, IM. And I think that what these services do is really help keep our community safe by being the community ourselves, right? Caring for our own and learning. You're trained in how to hold space safely, and to how to get help as needed. So you can refer to the Zendo's website for all of the training that they have available to you. And Fireside Project also has some great opportunities for those of you who want to be involved. You can help hold space on the line. It's got a lot of hours of availability for you to be there. They'll train you in doing so. They have 2 job opportunities right now that nurses could apply for. One is an outreach director, and one is as a part-time supervisor. So since they've opened last year, they've helped keep countless people from the ER or from hurting themselves. And they're having a research study done to prove the efficacy, not to prove it, but it is demonstrating an efficacy of having a presence of the line for people trained to hold space for those in crisis or need. They need to be having the experience at that time under the influence of medicine that they self-ingest, or it's an integration support line. And here's where we're seeing the real need for integration already in our country. And people have called in with stories about experiences they've had in the 70s that they're trying to integrate, and they read about it in the Rolling Stone. Or, people call often to try to integrate, or repeat callers is what I'm trying to say. So what this is just being there, and you never know who's going to call or text, and you are just there for them. And you're being that person that they don't have to help get them through this experience. So for people who want to learn about the medicines themselves, their effects, the time, the duration, the interactions, and how to be with people while they're in these experiences, those are 2 of the most wonderful ways to gain the experience and have been life-changing for me. And the most special thing about being with people in these moments, they're so tender, they're so raw, they're so vulnerable, and you're witnessing or hearing stories they've never shared with another soul, their secrets. Or, we have vets call with profound PTSD, or people who've suffered sexual trauma. So there isn't really another place I know where you can get this experience currently. And so I would encourage you to consider both Zendo and Fireside Project at this time as a great way to gain experience yourselves and to get back to the community.
Yeah, excellent. I've volunteered with Zendo quite a few years as well, and it's a wonderful experience to be able to sit with people and help them transform and go through these experiences. And specifically as a nurse, working as the medical kind of liaison there, to be able to use our skills that you were describing earlier, to be able to assess what's going on. Is this a medical need that we need to escalate, or are they safe to come on in and process?
Definitely, Wendy.
Yeah. So I would encourage any nurses listening to volunteer. Zendo also goes to other festivals as well.
Yeah, that's right. You've been to South Africa, and I journeyed there as well, in Costa Rica, and it's really incredible. And another example is once you learn things that you do in the Zendo, you'll kind of find yourself at a show or an event or anywhere, and somebody will be magnetized to you that actually needs your skill set, right?
Mm-hmm.
And it will start happening. And the other great thing is, I'll use my good friend Adele as an example. She's since helped to create and design a space at Nowhere Barn in Spain. So I got to go and witness a way that she did this a little bit differently, and you can go to events on your own. I know Adam Rubin is a wonderful harm reduction colleague of mine who invited me to be part of the Fireside line. And I've watched him in so many spaces and at so many events just hold space impeccably. But you can tailor this training to the events in your local areas and things that you like to go to attend. You can create this yourself. And so that's one of the great parts. You can transform the training and widen its reach.
Oh, absolutely. All right. Let's see. So what role do you see nurses taking in terms of advocacy for changing laws or policies? Or we've talked some about harm reduction.
Mm-hmm. Well, I think that I see a need right now, and then I see what I imagine in the future. So the need right now, and our colleague Andrew's been, pivotal in helping get this conversation going, is right now nurses aren't really, I'll put this in quotes, at the table. And we want to be there for when laws are made, and will we be able to practice as a nurse? So if you want to be able to practice as a nurse or an advanced practice nurse, you need to have involvement now in what is happening, because we're at the beginning and we need to create the future that we want to see and be a part of. For example, what kind of credentialing are we going to need? What kind of licensure? What kind of extra trainings? How are we going to get paid? Is insurance going to cover a nurse to do this service? So as far as advocacy right now, I think we need to figure it out. How are we going to shape this? And we need to give our time and our energy and our resources to figuring out how we can make sure we're treated equally with therapists and doctors in these conversations. And also if we can practice medicine in other ways, if we can do our own administration during hospice, during a home funeral, home dying experience, right? Like, where can we practice? How can we do it? And who are we accountable to? And how will we be equitably reimbursed? Speaking of equity, that's another way we need to advocate. I know that my patients come from all walks of life with limited resources, maybe without money, a huge unsheltered population in San Francisco, dual diagnosis, so much need. And when I worked in Oakland, there's so much need. If we're going to break these endless cycles of poverty and violence and abuse and trauma, we have to heal the trauma. And I think psychedelic medicines and therapies are the way to do this for now. That's what I'm called to do. We need to advocate for accessibility for our patients so that it's not just for rich white people with money and big farm. We need to fight against big farm patenting things and taking them away from us and our planet, right? These plant medicines are a gift to us, and they're here to heal us. And we need to heal the planet and help heal one another. And we can't let the powers that be take this from us. This has already been gifted to us, and we need to fight to protect those plants, those frogs, those medicines, the forest, all of those things from the bigger institutions that have no care for them. And then one other thing I want to add is I think it's critically important for nurses to be involved for their own self-care. And this is highlighted, of course, with the pandemic and everything happening with nurse burnout, suicide, nurses leaving their jobs that they've loved forever, all of our experienced nurses going. I think that we need to establish ways for these medicines, these psychedelic-assisted therapies, to be available to nurses and doctors without fear of losing their licenses, and a sustainable way for them to have access to the medicines as well. So I see creating ways for healthcare providers to receive the care themselves as another front where nurses can be an incredible part to help create a new reality and a new paradigm.
Right, absolutely. And I know there are some studies in the works looking to treat, first responders and beyond just the PTSD studies. Yeah. So just maybe another question or two, and then we'll get to the audience questions. If you have any more, throw them in the chat here.
All right.
But yeah, so what perils do you see? You've touched on this a little, but with the mainstreaming of psychedelics, what should we be watching out for?
Yeah, a loss of our own ability to access these medicines. And I also see a peril with the indigenous communities. And again, like I mentioned, destroying species or them becoming extinct, for example, with the iboga. And I think we really need to elevate our awareness of what it is we are using, where we're getting it from, how it's sourced, resourced, or create sustainability practices for those, in particular plant medicines. Other perils I see, I see this in the ER all the time. People do not know what they're taking. And I worry that a lot of adverse effects and deaths are going to occur in overdoses by things maybe being contaminated. So I really want to see a push for drug testing. And so I think it's critically important that people are able to test their substances before they ingest them. And I think a peril is that, a lot of people are going to be using these and having experiences without support, and they're either never going to want to use them again, or they're going to have a bad outcome, or they're not going to be able to integrate. And we already are seeing that. People coming back from these huge journeys, whether home or abroad, and they're unable to bring what they've experienced into their reality. And no one can understand where they're coming from. So I think the perils really lie in educating ourselves not only about where they come from and how we use them and safely and test them, teaching everyone else about them too. So, and I do fear the monetization and medicalization in some ways. Absolutely.
Right.
I think that I'm so happy for the research, and I'm so excited to do it. It's brought us to where we are. And there's some big dreams I have, but I also want to make sure they're available otherwise to all the other practitioners and chaplains and ceremonial ways. I don't want it to be zeroed in on just the medicalization.
Mm-hmm. All right, so final question here. If you could go back and give your younger self a little bit of advice, what would it be?
I think for my younger self, I would really want to learn how to say no and have more boundaries personally and professionally. And I would say to really find what I love and to not get trapped in this need to have a job or an income or kind of playing this game. I think that the nurses now are so lucky because they have the opportunity to work in this field. And so for my younger self, I would say, stop spending so much time on your career for this possible outcome and be present. Be present with your family, your friends, your love, your community, be outdoors. Don't get stuck chasing this path because that's not what matters, right? So if you love nursing, remember to love yourself, self-care, and remember to love all of the things that you have in your life beyond nursing so that you can sustain a career in nursing. So I would say that.
All right, excellent advice. So here we have some questions from the audience now. Okay, in regards to psilocybin, since the legalities of this therapy is still underway as research progresses, what do you anticipate the psych DNP, PMHNP roles will be in psilocybin-assisted therapy?
I think that, again, this is that iffy area where we can predict. But if it's decriminalized and if we're working for an organization that's above board in this context, I think we could protect our license and administer these medicines. Absolutely. I see it's particularly starting in palliative care, death and dying, and hospice transition. I think that'll be one of the first places it's incorporated because of the excellent research so far and because of the need for it. And we have all the baby boomers coming, and their time is coming to pass and transition. And this is a whole generation of people who have known and loved psilocybin. And I think in the role, again, as a DNP or PMHNP, this is where I think we'll have a lot of autonomy. I'm not sure that depending on the scheduling, we will be able to prescribe it independently without a supervising physician, but I'm going to be ready to do so. And I think that we would certainly be able to perform the whole session and to refer clients or take on the clients ourselves and to do the therapy. Absolutely. It again comes back to that being able to diagnose, treat, and prescribe and give the therapy. So whether we still have to have a little bit of supervision or not, I think that's one that we will be able to do a lot of great work with.
Right. Yeah, I think it varies so much by state, whether nurse practitioners are able to independently prescribe or not.
Yeah. And this is, again, where we
go to a nationalized system, yes.
Yeah. We need to be a part of this conversation so that we can lay the groundwork and the laws and the licensing bodies. We can make it happen, right? Otherwise, we'll be ignored or we won't have that ability.
Right. Okay. This question from Evan. Most RN or NP jobs don't look for nurses with psychotherapeutic training. How do you bring psychotherapy and somatics to your non-psychedelic RN or NP career?
Well, actually, as a bedside nurse, I bring in everything I've got all the time because
Absolutely.
You've got to be adaptable. And people are sick of the medicines and they don't always want these medicines, right? And if you can give them, how many times have I used guided imagery or breathing or different techniques to transport them away from this situation that they're in, all the time, every day in my job. And I think that it's about the story. So the therapy component comes in is I'm witnessing this person and I'm listening to their story and they can tell it to me safely. They know they can trust me. And so all of these things, everything I've been trained in is with me at all times. And there are, of course, some things we are not allowed to do and I wouldn't do. But there's often a lot of different ways to do the right thing. And you need to do the right thing for your patient with what you're trained in. or follow your heart intuitively. But yeah, I think the more that I've learned in every type of training that I've had, it all informs one another. And we need to use all the tools that we have. And this is especially important when you're in a bigger festival setting with numerous guests and numerous people. And so everybody needs a different thing. And often one person may need a number of different interventions in one session. And so, yeah, you can bring it in and you just have to do it wisely. And you have to ask permission. You have to ask consent of the patient if you can, and offer it.
Yeah, I would agree. I'm trained in Hakomi and systematic mindfulness psychotherapy technique, but it's just sort of the way you embody yourself, right? So being trained in these different methods, like you've touched on, doing your own self-work. By training in these methods, you do your own work, which then interacts and changes how you interact with others, your capacity to hold space and to reflect and to be. It just makes you a better human, I think. All right, a question from Hannah. What is your stance on the newly surfaced issue in psychedelic spaces of abuse perpetrated by the practitioner or guide? How do you envision us as nurses preventing harm in psychedelic spaces?
First, I'd like to say it's not newly surfaced, but it's coming into this awareness. Now, in the medicine circles in Peru, for example, or Brazil, this abuse, this ego, this power, this has been going on for millennia, right? People look up to the person offering them the medicine, the practitioner or guide, and they trust them. So I would say there's a longer background of this type of abuse happening, and these spaces are numerous. And my stance is that it is unacceptable, and that people need to be held accountable for that, and that reparations need to be made, apologies and reparations. And again, as nurses, we're the most trusted profession. And that's because we are, licensed. We are held to an expectation, and we are trained, and we have rules. We have all these expectations, and we have to abide by them, or we will lose our licensure. And in a lot of these other spaces, people haven't had that. As our job as a nurse, again, this comes back to doing your own work. You've got to learn how to recognize if something's not right with you. Are you spending more time with this person? Are you having more conversations with them? You need to check yourself or the feelings that you're having, right? And this is where, as a nurse, we have to learn about those big ideas of therapy, transference and countertransference, and where I have room to grow. You can't act on things that come up always, and you have to maybe disengage, and you need to have supervision, you need to have mentorship. So I think that I envision us as nurses establishing a way to create our own code of ethics about this particular type of violation, and a way to be held accountable, and have open transparency about it. And I think it's a really important thing for us to talk about. And this, the best that I can do personally is make sure that I'm recognizing what's going on, and also being cautious. If I do choose to go to another country, I need to be careful about who I'm going to be with. What kind of medicine am I going to take? Where is this set and setting? Am I safe there? Because the smartest ones of us and the most street savvy can still be in an altered space and be taken advantage of. And so I think we need to acknowledge that it is risky, and we need to be careful. And in a therapy setting with MDMA, it's also risky. People's boundaries, they blur, and their ability to hold space really depends a lot on their own relationship with themselves, and their ability not to give into any of those things that come up, because sexuality is going to come up. And so you need to be solid in your own training.
So, yeah, thank you, Liz. And I think we're just about at time here. So I think we're going to wrap this up. Is there anything you want to add, Liz? Thanks so much for talking with us today.
Oh, no, it's been a lot of fun. And I really hope that those of you tuning in now and in the future will consider helping our organization. Let us know topics like what you just asked about, the things that are important. And what can we do to make this the best future for nurses with these therapies? And the last words I would say is, I think it's really important for us to be kind to one another right now. It's really hard as nurses right now, mental health nurses, bedside nurses, community health nurses, primary care, hospice, and just be patient with each other, take a deep breath, and try and bring these psychedelic space holding ethics to your own nursing practice and your own bedside practice.
All right. Thank you very much. And we'll hope to see you all next month for another Psychedelic Chat. Feel free to share the links with your friends. This will be archived on YouTube right after this. Thank you.
Thanks, Wendy.
Bye.
Bye, everybody.
Mhm.